Imagine for a moment that your body is a high-performance engine, one that has carried you faithfully through decades of life, work, and family milestones. You expect that engine to run smoothly, yet lately, you have been feeling a strange, persistent heaviness. Perhaps you've been told by your doctor that your blood pressure is creeping up, and you were handed prescription that you were told would be your best friend for the rest of your life. But what if the very chemical compound meant to protect your heart was actually contributing to a slow, systemic erosion of your vitality? We are living in the year 2026, and the data emerging from long-term clinical observations is painting a picture that many in the medical community are hesitant to discuss openly. Today, we are going to dive into the uncomfortable truth about the most common blood pressure medications and why they might be silently sabotaging your energy, your mental clarity, and your long-term cardiovascular health. Before we strip away these layers of misinformation, please take a quick moment to hit that like button and subscribe to this channel. Sharing this information helps us reach others who are currently suffering in silence, and I would love for you to comment below with your biggest question regarding your current daily routine. My name is Dr. Harrison Blake, and for the past 15 years, I have dedicated my career to investigating the intersection of clinical medicine and natural physiological optimization. My goal is simple: to help you move away from the cycle of dependency and toward a life defined by genuine health, high energy, and proactive longevity. When we talk about blood pressure, the modern medical approach often fixates on a single number. We see a high reading on the screen, and the immediate reaction is to reach for a pharmaceutical intervention to bring that number down at any cost. But I want you to visualize your cardiovascular system as a complex network of plumbing. If your pipes are carrying sludge because of poor diet, chronic inflammation, and metabolic stress, simply forcing the pump to work less hard does not fix the sludge. In fact, it might just be masking the symptoms of a much deeper, more systemic failure. Many of the most common antihypertensive drugs, particularly beta blockers and diuretics, function by artificially dampening the body's natural responses. These medications are not restorative. They are inhibitory. They tell your heart to beat slower or your kidneys to dump minerals. But they do not address the root cause of why your blood pressure was high in the first place. You see, your body is incredibly intelligent. If your blood pressure is elevated, it is usually because your body is compensating for something else that is out of balance. Perhaps your insulin levels are chronically high due to a diet rich in refined carbohydrates, which causes your kidneys to retain sodium. Or perhaps your sympathetic nervous system is stuck in a state of high alert because of constant, unresolved stress and poor sleep. By simply taking a pill to lower the pressure without changing the environment that caused it, you are effectively turning off a warning light on your car dashboard while the engine continues to overheat. Let us look at cholesterol, a topic that is inextricably linked to this conversation. For years, we have been told that high cholesterol is the primary enemy of the heart. However, in 2026, we have moved into a more nuanced understanding. Cholesterol is not the villain. It is a structural component of every cell in your body, and it is a necessary precursor for your hormones. When your blood sugar is out of control and your insulin is constantly spiking, you create oxidative stress in your arteries. That oxidative stress is a cause of microscopic tears in the arterial lining. Your body sends cholesterol to patch these tears, much like a handyman applying spackle to a wall. If you stop the cholesterol from arriving, you do not fix the wall. You just leave the structure vulnerable. When we combine blood pressure medications that alter basic metabolic signaling with the incorrect assumption that cholesterol is the sole factor in heart disease, we create a recipe for what I call metabolic stagnation. This manifests as that persistent fatigue you might be feeling, the brain fog that clouds your afternoons, and the gradual loss of muscle mass that occurs as you enter your 50s and 60s. You might think that your exhaustion is just a natural part of aging, but I am here to tell you that it is frequently a secondary effect of suboptimal metabolic health fueled by stagnant, unaddressed lifestyle habits. Now, let us address the elephant in the room: triglycerides. Many people focus intently on their total cholesterol number, but triglycerides are actually a far more accurate marker of your metabolic health. Triglycerides are essentially the fat circulating in your bloodstream. When you eat, your body uses what it needs for immediate energy and stores the rest in your fat cells. If you have high triglycerides, it means your body is struggling to process the energy you are consuming. This is a direct consequence of a diet high in refined carbohydrates. When these levels are high, your blood becomes more viscous, making it harder for your heart to pump. This, in turn, forces your blood pressure up. If you are on medication for blood pressure, but your triglycerides remain elevated, you are essentially trying to put fire out with a paper fan. The medication forces the pressure down, but the underlying issue, the thick, energetic sludge in your blood, remains untouched. This is why so many patients feel worse after being placed on these medications despite their doctors telling them that their numbers look great on paper. Health is not just about the numbers on a lab report. It is about how you feel when you wake up in the morning, your capacity to handle stress, and your ability to carry your own groceries or play with your grandchildren without feeling winded. The most common mistakes I see in clinical practice involve a passive approach to health. People wait for a diagnosis, receive a prescription, and then assume their job is done. They continue to sit for 8 hours a day. They consume food that has been stripped of its nutritional density, and they ignore the quiet signals their body is sending them. Your body is a master of adaptation, but it requires the right raw materials to function. If you are feeling chronically tired, it is likely that your mitochondria, those tiny power plants inside your cells, are not getting what they need to produce ADP, the energy currency of your body. Magnesium, potassium, and vitamin D levels are often deficient in people struggling with blood pressure issues. Yet, these are the very elements that help regulate your vascular tone and support healthy heart rhythm. When we look at the standard approach, we rarely see an emphasis on replenishing these essential nutrients. Instead, we see a focus on blocking chemical pathways that are essential for long-term health. It is a fundamental shift in perspective that we need to embrace. We must start treating the human body as an integrated ecosystem, not a collection of parts that can be fixed with independent, disconnected components. Consider the role of stress. We often dismiss it, thinking that stress is just a normal part of living in the modern world. But chronic psychological stress keeps your sympathetic nervous system in a state of high alert. This triggers the release of cortisol, which keeps your blood sugar high, which forces your insulin to climb, which promotes oxidative stress, which leads to arterial damage, which causes your blood pressure to rise. Do you see the cycle? It is a continuous loop. Taking a medication to block the symptoms of this cycle does nothing to address the chronic stress that started the chain reaction. If we want to achieve true health and longevity, we have to address the stress response. This might mean incorporating simple science-backed practices like mindful breathing, light movement after meals, or even just spending more time in natural light, which helps regulate your circadian rhythm. These are not just nice ideas. They are clinical interventions that can profoundly change your physiological state. Small, consistent changes in your environment and behavior exert a much more powerful and sustainable influence on your health than any synthetic molecule ever could. You might be asking yourself why you were never told this before. The reality is that the medical system is designed for crisis management. It excels at keeping you alive after a heart attack, but it is not optimized for preventing the heart attack in the first place. That responsibility falls entirely on your shoulders. You are the protagonist of your own health journey. The doctors can provide the tools, but you must provide the environment in which your body heals. This is why I emphasize the importance of understanding the basics of nutrition and movement. When you start to feed your body real, whole foods, food that have not been processed in a factory, your triglycerides naturally drop. Your inflammation decreases. Your arterial walls start to heal. Your energy levels return. And most importantly, your blood pressure begins to stabilize on its own because your body no longer feels a need to fight against a toxic metabolic environment. It is a transition that requires patience and dedication, but the result is a level of vitality that you likely have not felt in decades. Do not be discouraged if you feel like you have been doing it wrong for a long time. The body is remarkably resilient and capable of healing if you give it the right starting conditions. Let us summarize the core concepts we have covered. First, blood pressure is often a symptom of an underlying metabolic imbalance, not necessarily the primary disease itself. Second, Relying solely on medication to mask this symptom can often lead to further stagnation and reduced energy. Third, your triglycerides are a vital indicator of how well your body handles energy, and they respond beautifully to diet and lifestyle changes. Fourth, your body is an integrated system that reacts to stress, inflammation, and nutrient status in real time. Fifth, and finally, you have the power to change your physiological trajectory by making informed, daily decisions about what you eat, how you move, and how you manage your nervous system. These are not complex, unattainable goals. They are simple, logical steps that anyone can take to reclaim their life. I have seen countless people in my practice transform their health by simply shifting their focus from fear-based medical management to a proactive, bio-individual approach to wellness. They stop looking for the magic pill and start looking for the magic in their own daily routine. As we look toward the future of health in 2026 and beyond, it is clear that the most effective medicine is the kind that you practice at home. It is the quality of your sleep, the variety of the nutrient-dense foods you consume, and the strength of your commitment to yourself. You deserve to feel vibrant, and you deserve to know the truth about what is happening inside your body. Do not settle for being a passive recipient of standard care. Ask questions, seek to understand the mechanisms of your own biology, and take control of your habits. You have the potential to rewrite your story, regardless of how long you have been struggling or what a piece of paper might say about your current health status. It takes courage to challenge the status quo, but the reward is a life filled with energy, purpose, and the strength to enjoy every moment. Start today by making one small adjustment to your dinner, or perhaps by taking a 5-minute walk after your next meal. These small, incremental wins are what lead to massive, long-term transformations. In closing, remember that your heart is the center of your vitality. It works tirelessly for you every single second of every single day. The best way to honor that effort is to provide it with the environment it needs to thrive rather than the chemical inhibitors that force it into a restricted state. By focusing on metabolic health, managing your blood sugar, keeping your inflammation low, and supporting your body through proper nutrition and movement, you are doing more for your long-term cardiovascular health than any pharmaceutical could ever achieve. I have seen the results firsthand in my clinical practice, and I know that you are capable of achieving the same consistency and success. Thank you for taking this time to invest in your knowledge today. If you have found this information valuable, please make sure to share it with someone you care about who might be struggling with these same issues. Subscribe to the channel so you never miss a new update, and leave a comment below letting me know what one positive change you are committing to starting this week. I read every comment, and I am here to support you on your journey toward better health, more energy, and a longer, more vibrant life. Stay consistent, stay curious, and I will see you in the next video.